Any guesses about today's head of conversation? No? Well, it's one of the things interesting and to keep you updated all time round. It's the special and targeted drug delivery systems. Let's actually discuss them. Welcome all to Is Pharmacology Difficult podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best, simplified, basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Just give a pondering thought. What is the need of drug targeting? You understand now? No? Okay. Drug targeting is simply the capability of molecule of drug to reach and accumulate in target organ. Or it's the attainment of tissue selectivity in a proper way so that final achieved concentration of drug is high at the diseased site and it's very low or rather minimal at the non-target or other organs or sites at a level so that no effect or toxic or side effects of drug they are seen or attained. Got this whole concept? Actually, it's of great advantage, and the most important one is the great reduction in amount and frequency of the dosage of drug. A better uniform drug effect is achieved. There are less adverse effects and there is a decreased circulating drug level fluctuations. And yes, the other side of coin is a little dark too. High cost makes the productivity difficult and there's a reduced flexibility regarding the dosage adjustment. The two basic types, they are passive and active drug targeting. In the former, the circulation time, it determines the success of drug. Nanoparticles used, they are cloaked with some coating. One good coating done is of polyethylene glycol. It makes the nanoparticles hydrophilic and they become anti-phagocytic finally. Nanoparticles, they stay in circulation for long duration. Their apt size is between 10 to 100 nanometers, ideally to achieve a desired result. The other type is the active targeting. In this, the nanoparticles, they are loaded with drug and the process is enhanced to achieve more specific target site. What can be the best way? The best way is to get to know the nature of the receptor which acts as the target. Cell-specific ligands, they are utilized then, and nanoparticles, they bind specifically to the cell having complementary receptor. Now, one very good example was actually in a prior or previous era. It was the utilization of transferrin as the cell-specific ligand, which binds nanoparticles to target the tumor cell. And then there was an increased uptake noted, right? Got it? Active targeting was also seen with magnetoliposomes, which are used as contrast agent in magnetic resonance imaging, very famously abbreviated as capital MRI. So the purpose of drug targeting is 1. Better patient compliance, 2. Improvement in drug delivery at the desired site, and 3. Prolonged duration of drug action. Some very good mentions of different type of drug targeting systems. They are ocuserts, progestaserts, liposomal drug delivery, prodrugs, computerized miniature pumps, and monoclonal antibodies. Among these today, I will be covering all except the monoclonal antibodies. Okay, let's get started with the first one. Ocuserts, they are thinly shaped, quite elliptical or oval. The drug is kept in a reservoir, slowly released via membrane by diffusion technique at a constant rate. Very good example is of pilocarpine ocusert. It finds very good use in glaucoma. The methodology is it's kept under the lower eyelid and pilocarpine is steadily released for 7 days. And dosage frequency is reduced from daily to weekly. Next, let's talk about progestaserts. They are simple intrauterine devices inserted inside the uterus for the contraceptive purpose. And the release of progesterone drug is constantly made toute l'année. Yes, all round the year. A little French part. Next, I want to tell you all about liposomal drug delivery, where sonication of phospholipid suspension in the aqueous media is done to produce minute vesicles named as liposomes. They retain the non-lipid soluble drugs for long periods of time till they disrupt. The best example of drug available as liposomal form is amphotericin B, capital B. It's an antifungal agent. The route of administration is intravenous or capital IV. Ignoring the high cost of this preparation, you can count its benefits on your tips, like less nephrotoxicity and better tolerability compared to other conventional preparations. Next, what we have on our list is the prodrugs. Definition is known by you all. Inactive drugs metabolized in body to their active forms. The biggest purpose is to cover up the disadvantages of useful preparations of the drug. Let's understand it all with proper examples. The first one is the levodopa. It's a prodrug. It covers up the disadvantages of dopamine. Dopamine is the active drug and it has the incapability of crossing the blood-brain barrier. The second example is penicillin esters like procaine penicillin capital G and benzothane penicillin capital G. Both of these, they provide sustained drug release owing to the slow hydrolysis and they overcome the disadvantage of penicillin of short duration of action. Closing the talks of the day, final word is about computerized miniature pumps. Well, these preparations, they are made in a way that release the drug at a definite rate. It can be continuous as in insulin or it can be in pulses as in the gonadotropin release hormone abbreviated as capital G, small n, capital R and capital H. Sometimes these are fitted with glucose sensor devices which serve the purpose of triggering desired insulin dose as per body's demand. Two types much in vogue nowadays, they are invasive and non-invasive miniature pumps. Whoops! Here creeps the ending of today's long episode, just long, though it never seemed so. Right? Okay, I'll leave that decision on you all. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about the medical sciences, drug information, updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name as Pharmacology Difficult. If you are listening for the first time, do follow me here, whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.